Welcome to Health Talk. Today we have with us Dr. Edward Diao, Professor Emeritus of Neurosurgery and Orthopedic Surgery from University of California, San Francisco School of Medicine, and former Chief of Hand, Upper Extremity, and Microvascular Surgery from San Francisco. Today's topic will be hand injuries and minimally invasive microvascular surgery. So welcome. So who gets hand injuries?
Well, Gloria, it's great to be here and share with you some of the new exciting things in the field of hand surgery. So to answer a very basic question, who gets hand injuries or who should see a hand specialist? Well, I think people young and old are prone to get injuries. We live in California where we love an active lifestyle. We like to run, bike, swim, ski. And sometimes there's a mishap and there's injuries of a traumatic nature, a slip and fall, a broken bone, a sprain that doesn't get better. Then there are other activities that are associated with problems. Too much typing, a little too much gaming, things like that, repetitive activities that can cause other types of problems. And then there's another broad category where in the older population there's a tendency to develop arthritis in certain joints. And there didn't used to be very good solutions that were very easy to perform on the patients, but now with minimally invasive techniques, we have new treatments for these problems that are working very well.
So usually a person comes into your office or your practice or the hospital saying, I've been video gaming 18 hours a day, I'm in a competition and I've become first place finisher, but now my hand hurts and I have pain radiating to my fingertips and it won't go away and it's lasting for a month. So the key word for you is what? It won't go away?
Well, if they're making a huge living doing gaming as a professional, then you've got to work around the problem. Of course, the first advice is to try to limit the activity and cut down on the thing that may be provoking the problem. Simple things like rest or taking anti-inflammatories or maybe using a splint. And often that works, but not all the time. Sometimes the problem is established and just doesn't go away by itself. And then we go ahead and, of course, try to make the diagnosis. And there are certain tests that are very helpful if somebody has something like carpal tunnel syndrome, which is sort of what we're talking about. And in those patients, some of them, if they don't get better with these other measures, they're a candidate for having some surgery to alleviate the pressure on the nerve. And how that used to be done was through an open incision, and now there are minimally invasive techniques where a much smaller incision can be used to do the same job or even a better job in terms of releasing the nerve.
So the older technique meant that people would be out of work or unable to do their activity for about 3 to 6 months in recovery. So this one halves this.
Right. For example, the standard carpal tunnel release, and I'll show you on this model that I've brought. The standard release used to be from the wrist itself to the palm, so an incision this long, and the recovery often would take, say, a month or 2 or even 3 to recover and lose the tenderness and swelling, allow people to grip. With the endoscopic technique, the incision is from here to here only in the wrist crease, at least the technique that I've been using. And then a device is placed underneath the ligament like so, and then there's a microscopic cutting blade. And we're watching this on a TV monitor, so we get a telescopic view of this part of the anatomy. What that allows us to do is to do the ligament release, which is the main part of the operation, and cause much less damage to the surrounding tissues. Less damage, less cutting, means less time for recovery.
Less swelling, less bleeding.
All of that. And that's all to the patient's advantage, and that's a quicker recovery.
So you said sometimes they only have a bandage for 1 week, and then after that a Band-Aid.
Right. Usually the wrap is for a week just to let the incision heal, and then all they have is a Band-Aid, or if they're a fast healer, nothing at all.
Now what happens with the people with carpal tunnel, there is a little band here, the retinaculum, that holds it. So you go underneath that?
Right. I mean, these are all natural parts of the body, but because there's too much pressure on the nerve, the thing that is easiest to sacrifice in order to make more room for the nerve is this ligament, which is like a bracelet of soft tissue around the bones, sort of like this. And this is a bone model. The pencil would be where the median nerve lives, and it's in a valley between two bones in the wrist, and then there's a ligament on top. So what we do is we cut that ligament, and that gives the nerve a little bit more breathing room. And it is, when people say, hey, it feels like my circulation is going away, what actually happens is because of the nerve compression, there isn't that much blood getting to the nerve, and it does feel like there's no circulation in the hand. So that's one of the things that can be improved with the carpal tunnel release.
Oh, so they feel better circulation.
Right.
And they don't have no longer the pain radiating to the fingertips.
Right. Sometimes it's pain. Sometimes it's being woken up at night with symptoms of numbness and tingling and shooting pain, either down to the thumb, index finger, middle finger, ring finger, or actually up the forearm, or both. The trick is, though, making the diagnosis is important because there are other things that can mimic a carpal tunnel syndrome. So it's not that everybody who has a little numbness in their arm has carpal tunnel syndrome. And that's another reason why seeing somebody who's a hand surgery expert is a good idea.
So you can't Google yourself and make the diagnosis and say, okay.
Well, you can Google yourself, but I wouldn't just rely on that. Sometimes a little verification by an expert is helpful.
Now, you've played a role in this small incision minimally invasive surgery. Tell us a little bit about your role.
Yeah, well, it's great to live at a time when there are new innovations coming. And so with these techniques, certainly I've been involved in trying to bring these techniques to a wider audience, certainly to train surgeons with some of the special skills required to do these operations. For example, this endoscopic carpal tunnel release system has been around for between 15 and 20 years, so it's not absolutely a recent innovation. But I was involved in training surgeons, and even now in any major city, it's not every hand surgeon who's comfortable doing these techniques. So I've brought on some of the training innovations for these materials. Also, I was involved in designing a major multi-center study looking at the results of endoscopic carpal tunnel release compared to open. And of course, in this day and age where there's a lot of emphasis on healthcare dollars and what gets better results, we actually showed that there was this 30 to 50% reduction in the recovery time with the endoscopic carpal tunnel release compared to the open. So we proved it scientifically that if you had skillful surgeons who did it without injury or complications, that the patients would recover faster.
Now, about those people who are 50 to 70 who have the arthritic problems with the hand, tell us a little bit about that.
Yeah, well, that's very interesting because, of course, when I said we're here in California and people enjoy an active lifestyle, you know, the 50 to 70-year-old now is involved in cooking, gardening, tennis, golf, sports, all the activities that require manual hand use. And one of the most common areas to have arthritis in that age group is at the base of the thumb.